Welcome to our fourth and final National Academy of Construction Ask Me Anything for spring 2022. My name's Keith Molenaar. I'm an NAC member and I'm a professor at the University of Colorado Boulder. The National Academy of Construction was established to recognize our industry leaders. An important purpose of the Academy is to provide a network system, a linkage between the past and present participants in the industry. As such, we've established the NAC AMA to help transfer knowledge to our next generation of construction leaders, and that's all of you. So thank you again for joining us today. So the format is really simple. Our speakers will make a short presentation on a topic. In this case, it's going to be the healthcare industry. I think you're going to be really excited to see this, and give a little bit of perspective. If you haven't already, please, this is important. Go ahead and email in your question at nacama@colorado.edu. I'll also put that up in the chat in a moment as well. But you need to email that question to be eligible for our $500 scholarship, which we'll announce at the end of the event. So with that, I'd like to introduce Christine Flaherty. Welcome, so great to see you. She is a Senior Vice President of Facilities Development for New York City Health and Hospitals in New York City. She holds a bachelor's degree in civil engineering from Bucknell University and an MBA from NYU Stern School of Business. At NYC Health and Hospitals, Christine leads all real estate, planning, design, construction, and facilities operations for the largest public healthcare system in the country. Really breadth of scope here, so make sure you ask questions about all those different aspects of the industry here. She recently led the emergency system-wide improvements and expansions to address COVID-19, including emergency projects. She's also responsible for a staff of over 60 professionals and 650 union trade professionals system-wide. She was previously Associate Commissioner for the NYC Department of Design and Construction Capital Delivery Program, and she has an excellent track record in innovative and accelerated emergency and urgent care programs in both the public and the private sector. Christine is an ACE board member in the New York chapter. If any of you are ACE students here, I know it's a wonderful program. She's also a certified construction manager and has served as chapter president for the Construction Management Association of America, New York, New Jersey Metro chapter. Thank you for bringing such a wealth of experience for us today here, Christine. I'm really looking forward to what you have to talk about. So I'll go ahead and share your presentation. Great. When you say you're ready, but the floor is yours.
Absolutely. Well, it's great to be here. Thank you, Keith, and thank you to the National Academy of Construction for allowing me the opportunity to present to all of you on the Zoom, students that would love to share my journey and provide any context or answer your questions. So let's put the slideshow up, and I'll try to really quickly just walk through the health and hospitals journey, which has been my most recent leadership challenge. I think that's the end of the slideshow, Keith.
It is. I apologize.
Which shows you a picture of a lot of our facilities. We have over 20 million square feet across the city of New York, the largest public health system, as Keith had mentioned. And so really what I'm going to talk about from a leadership perspective is it's really not about the leader, it's about the team. And so here you have a picture of a lot of different team members, from boiler room to boardroom, to that amazing moment where our system, our healthcare heroes, were recognized in the Canyon of Heroes at the city towards the conclusion of this pandemic, now an endemic. And so this is just a number of pictures of our great staff. We could go to the next slide, Keith.
Great. And thanks for getting through my hiccup there.
No problem. So it is important, especially as young professionals and students, for you to think through in your career, what's the mission of the organization you're serving? For me in my current role, I'm serving a public health system, albeit in the physical space, and how that supports the public health system. That includes 11 hospitals, what's called diagnostic treatment centers, which are clinics, long-term skilled nursing facilities, home health, a health plan, as well as 50 community health systems. And really our mission is to provide care for all, regardless of status, So our mission is very dear to my heart. Even though I didn't go into medicine to practice, I have many members of our family that did, and knowing that you're helping support an environment for care and saving lives is just a very palatable mission to be a part of as an engineer, as a construction manager, or an architect. If we go to the next slide, this shows you our vision and mission and our strategic pillars as an organization. Also an important thing to try to understand as you look at companies of where you want to serve and work. And for us, we have very clear strategic pillars that guide us as we think about how our work overlays into the environment of care. Next slide. This shows you a map of all our hospitals. So if you weren't sure what the hospitals were, it includes ones like Elmhurst, which was the epicenter of the first response to COVID-19, as well as Bellevue, which is where the president goes if they're sick, and the Ebola patient goes when they land in New York City. So we have a number of very notable hospitals throughout the 4 boroughs. And then we have our skilled nursing facilities, which is where if you're no longer hospitalized, you go into a skilled nursing facility, and those are throughout our boroughs as well. Next slide. So our office supports the system, and we're called the Office of Facilities Development. That includes both the physical plant maintenance and ongoing operations of the physical plant, as well as real estate planning and capital. So design, procurement, construction, delivering, and facilitating capital projects to support all of the facilities, which as a public health system, our funding is not as robust as many private health systems. And so the state of our facilities and our infrastructure is an average of 60 years old, so way past useful life. And so there's a lot of, one of our workers called it, we're like putting bubblegum and bootstraps to keep things going, but we find a way because we're New Yorkers. Next slide. So this just is another cut of what our office does. We could go to the next slide. We also have a unit, aside from real estate, we're doing a unit for housing for health, and we're working to house our homeless population, which we have 20,000 homeless patients that we serve every day in different capacities. So I'm going to do a little bit of a story, and then I'll turn it over to questions as quickly as I can talk. I want to share the little journey of COVID, that little really impactful thing that we've all been living through. This is a photo on the right of Elmhurst Hospital, which was really one of our most challenged facilities. We really started planning for COVID before it arrived. We were doing what if scenarios. We were looking at all our negative pressure rooms, our isolation rooms, and we had to do the exercise of thinking about what we would do at all of our sites should we never be able to transfer any patients through between our hospitals. And that actual scenario planning really helped us as we all of a sudden were very quickly launched into quite a challenging journey for us all. Next slide. So our areas of focus throughout the pandemic was both wave 1, wave 2, wave 3, can't keep track. And so really very swiftly, we had to surge all of our hospitals and really create more patient areas for our patients. Our entire system became inundated with COVID-only patients, especially in the first wave, but not the other waves. And so really there was a lot of decanting. There was construction, 24/7 construction to stand up patient care areas, both offsite and within the hospitals themselves. Within the hospitals themselves, we did physical work with emergency contractors and our own in-house trades to really create more ICU capable rooms to really care for the most dire patient population. And we actually tripled our ICU capacity during that time, which was quite an achievement. We never broke, and we never got to a point where we had to turn anybody away. We also build temporary pop-up sites, alternative care sites. We were involved in standing up the tennis center as a hospital. We were involved in setting up a new facility out of Roosevelt Island, and we were involved in setting up 120 ICU beds at one of our hospitals while we were transferring patients in. Next slide. So this shows you a lot of our accomplishments. We also worked towards enhancing our air quality, setting up dialysis capabilities after the first wave, We led kind of a quick hit lessons learned as the first wave was winding down, and did further planning and implementation of emergency projects to be ready for the wave that came in the fall of 2020. And so this is just some of the work we did: resiliency towards oxygen, dialysis capabilities. Many patients were having a higher need for dialysis. We also really worked to look at opportunities to enhance our air quality throughout our hospital spaces and do enhancements throughout all of our EDs as well. Next slide. So this is another look at kind of how we looked at COVID as we were learning throughout the process. We were setting up what we would call hot and cold areas of the hospitals. Cold being you want to keep your ongoing patient care going for non-COVID patients. It was really important that we worked to establish a protocol to really isolate the COVID positive patients from the negative patients. And that took careful planning with all of our facility teams and our infection preventionists to try to create as many opportunities to create the flexibility and additional space so you could have concurrent parallel care happening throughout the hospital in different wards. That would also allow staff to, work on a hot unit for a while, but then also move to other areas of the hospital, because ongoing chronic conditions that require hospitalization also need to be treated. And that was very much critical during the later waves of COVID that we worked against. Also within a key consideration for our hospital system that had life-saving impact was level loading our patients across our different hospitals. We were very fortunate to have so many hospitals, 11, and so we had very tight situational awareness. We still do every single day. We know how many patients are admitted and where they are in our hospitals and how many are in the ED waiting. And we really stood up an amazing data team to really have situational awareness that helped us plan for our needs. During the first wave, we were like every day on the phone confirming the physical plant space so that we could ensure that the clinical operations team had a sense of any constraints that we might be having on the physical side. During the first wave, one of the areas that became critical was, both ICU, but the oxygen systems were being definitely strained. We were monitoring the oxygen utilization because that was the stage that unfortunately many patients were on ventilators. We were monitoring that as well. And so knowing all the situational awareness allowed our teams to kind of level load patients to the facilities that had that capacity. So very important work. Next slide. So these are just some fun pictures. I'll be really fast. During our surge construction work, we did something that was very helpful for, this is at Kings County and Elmhurst on the left. We brought oxygen into some of our behavioral health units. So we are also, we care for the largest population of mentally ill patients. And so, mentally ill patients are not necessarily not getting COVID and not needing oxygen. And so we brought those oxygen capabilities into both of those units to allow for low acuity care in those units and also for future surges. So that was something that was unique and different that we did during this planning and emergency construction. Next slide. This was probably one of our most challenging projects and most accomplished projects. This was a $100 million ICU project. We demoed, abated, built around the clock 24/7 and stood up 120 ICU beds, emergency ICU beds in about 4 months. We were called to do it. This was space that we knew we were going to plan to put something at North Central Bronx. And we had our emergency contractor essentially tearing everything down while the designer was designing plans, and the CM at risk firm was drawing up the pricing with their subs. Throughout this project, the designers were co-located. They worked alongside the builders. They worked against a not to exceed value, and it was done. It was accomplished. And this unit was used during wave 2. It was used during wave 3, and it became a receiving bay for a specific subset of patients that could be cared for. During the last wave, the FEMA volunteer corps that came up actually worked out of one of these units to care for some of our COVID patients. Next slide. We also stood up 3 different centers of excellence for long COVID patients. These were already meant to be primary care sites. And so we swiftly moved and partnered with Department of Design and Construction for them to construct, and we managed the designer. And we set up a site in Bronx, Queens, and Brooklyn. And these were in neighborhoods that were most heavily impacted by COVID. So high population of individuals that suffered from COVID, had the side effects of long COVID, at which, specific medical follow-up is recommended. And so these sites have all been opened, and they were done also in record time. The shortest was 6 months. The next was 7 or 8 months. And then the largest site, which was like six floors, was going to be used for a vaccine center, but recently opened up to see patients. So we're excited that these have come online. I don't have any finished photos here, but happy to share them. The latest mayor was at a ribbon cutting recently for this. Exciting. And you could go to the next slide, sorry, Keith. And so capital encompasses everything in health and hospitals world, a lot of resiliency, a lot of energy related work, but unfortunately, because our systems are so old, a lot of emergency type of work as well, because unfortunately, we haven't had the resources to reinvest in our systems as vastly as we would have liked. And to the far right at the bottom is our new soon to be named Ruth Bader Ginsburg Hospital that is under construction right now, and we're looking forward to opening this calendar year. That's a FEMA resiliency project, so that will allow the Coney Island campus, which was impacted by Sandy, to really have all of their inpatient care in the above the 500-year floodplain. So it was the most cost-effective to actually build a new inpatient tower and a flood wall and have an elevated ED for the future. So we're incredibly excited about wrapping up that exciting project. We also have a ton of energy related projects around our mechanical systems and trying to do everything we can to reduce our carbon footprint and our energy use across the city. And I think that concludes some of my highlights of H&H. It doesn't cover everything, but trying to give a little bit of a preview of the great work that happens at health and hospitals.
Yep, that's really great. Just incredible work that you're doing there. I know I already have a number of questions coming in about the work that you just went over. And I'll start with those, but maybe if I could just ask a personal question myself to
Sure.
get us going. What got you interested with the civil engineering background and construction? What got you interested in the healthcare industry?
So I have to say that I actually was recruited into the healthcare industry. I wasn't particularly focused on it. I got the amazing opportunity through referral to join the health and hospitals family. Although as a child, I always wanted to go into medicine, and I actually wanted to be an EMT before I wanted to be anything. And so I really felt like it was a journey of like the right place for me. I've realized how multidisciplined and even more complicated healthcare is. It's like taking construction management to the whole other level from a multi-stakeholder management perspective. And I've totally fallen in love with working in healthcare. It's like a really incredibly challenging area of the sector that I feel like it's kind of like what some people like to say about working in New York City, where it's like, if you can do it there, you could figure it out anywhere. I feel like healthcare has that shine, and that like you're really working across so many disciplines of many super smart people, doctors, infection preventionists, quality and safety, administrators that run hospitals. You know, there's so many different stakeholders. And then I would say the codes are always changing and evolving too. There's a lot of really process improvement mentality inside of healthcare, which is a really great similarity, I think, to capital delivery.
Sure. Yeah. I talk with my students a lot about just civil engineering and construction in general being a profession of care, right? Improve the world that we live in, creating better quality of life. And
yeah, absolutely.
And I think, yeah, your area really does epitomize that. And so it does sound thrilling. So let me ask you a question from Adriana. She wanted to know, what was the most challenging part construction-wise through the pandemic? So
it's hard to put it as one, but I would say, and the challenges evolved, I would say, Originally, some of the challenges were, getting the workforce to come in, especially the hired workforce. So I'd say the in-house trades, they were on the front line. They were like our Marine Corps first in. And then I would say the second was getting our union trades to come in, and we partnered very heavily with the local trades associations, and we were able to get amazing healthcare union construction heroes in. We didn't really have the construction supply chain issues until the later waves, I would say. And so I think each wave blended different challenges, I would say. And one of the advantages we had, I think, was that a lot of things had been shut down. And so that, people were, working, they wanted to go do project work. And so I think that was helpful. We did have some capacity constraints, and we definitely grabbed firms to kind of join our fold, because we couldn't rely only on a handful of firms. So we relied on as many as we could. But I would say, some of the challenge was mental tenacity, just kind of continue forging ahead and trying to keep the whole team, all the teams energized, given the challenges we were up against. So it was definitely, it was fun. It was a journey, but it was not simple or easy. That's for sure.
Amazing to see what came together so quickly, and I just overwhelmed by 120 ICU beds in 4 months. That's just
that was a project that was momentous. Yeah, and we had an amazing leader there who he would never give up. And every single day, they were all ensuring that there was an answer and a solution, and there's no RFI outstanding. We're solving it, and you got to keep going.
Well, Adrian asks just more general, similar question, but just more general. What are the toughest part about planning and coordinating construction for hospitals? How might it be different from other types of projects that you've worked on in the past?
I think communication and stakeholder management is super key. So I know that's a very technical word, but I think, expectation setting and having a clear understanding and ensuring that you're listening to the stakeholders. And so I think what happens about the built environment, what I found is that you need to be able to bring complex things into simple language so that all stakeholders can understand those constraints. And so you have, intensivists who run ICUs that are incredibly brilliant. And you have, the nursing staff who is, on the front lines caring for patients. And you need to be able to articulate the physical goals and translate with all those stakeholders to make sure that your outcome that you're trying to achieve is going to be the result that everybody's looking for. And I think in healthcare, it's more complicated than sometimes in more simple programs. All of those different built environments are incredibly important. I think, there are other fields that are also incredibly complicated, aviation, transportation, et cetera. And so I think it does boil down to communication. And in my case, I went into this field without being a healthcare expert, which in some cases people think is impossible, but actually it allows you to allow the experts to tell you what they need without you questioning them. I think that becomes an important element of success is having that partnership and respecting the people in their various roles and letting them give the feedback of what they need and translating that with the architecture team, the engineering team, and finding the solution.
Excellent answers. Appreciate that. So Chris and Cynthia are asking a similar question, kind of ties those last two together. And I'll just paraphrase, but what have you learned through these emergency projects in the pandemic that you would now apply to your everyday project management and construction?
Sure, absolutely. So I think we learned you need a bigger boat. So meaning you need to think through and have capacity to, especially if you're a large organization, to tap into multiple vendors so that you can have concurrent emergencies happening. We also learned, and I think some of us knew it, but it was very proven, that the more you can bring the designer and the builder together and have them collaborate in a way that is not ego driven, but technical solution driven, and invest in that type of collaboration, the better your outcomes can be, the sooner your outcomes can be. And I think the most cost effective it can be. We were running in a way that, we had not to exceeds for everything, but it was time and material, a lot of this work. But then when we look at the cost per square foot around that compared to a lump sum design bid build kind of thing, we came in at or sometimes below what we would have thought a traditional delivery model would have given. And it doesn't surprise me that that concurrent collaboration that was continuing to happen was helpful. I did learn from the emergency response, and one thing that I think as we transition out of that mode is that, highly fast-paced jobs do burn people out too. So you really need to balance ensuring you're not over pushing a schedule just to push a schedule. You want to make sure you plan it out when you have the luxury of time, and that you're allowing the team members to have an appropriate amount of balance in their lives. So I think, the emergency tested us all. It brought us together. But I think we definitely learned a lot along the way that we'll never forget, and it will definitely help us evolve in our thinking.
Excellent. So you touched on project delivery methods a little bit there, and Varun and also Oliver are asking about your preferred project delivery method, or Varun said it a different way.
Yeah.
How do you match delivery methods?
So our system, we don't always have the legal abilities to do everything we want. So I do think, and I think that I think there's ways to look at that. I don't think you can have a one size fits all for a project. Like, there's no silver bullet that's perfect. Certain jobs lend themselves to certain things. And so I think, we're right now we're in construction on a job that we've decided construction management guaranteed maximum price is a perfect model for. It's an interior major renovation in one of our occupied hospitals, a full floor. It allowed us to really do the final buys with the designer to finish up the drawings while the CM was already on board. And it allowed us a mechanism to kind of change order the guaranteed maximum price. That's not the kind of job I would ever want to do a design build on. Too many risks, and you'd want to have a little bit more control as an owner. However, if we're doing a boiler plant and it's pretty standard performance spec, and we've kind of mapped out how we want those systems to be replaced at an operating hospital, which is our world, then you can think about design build, and you can think about really putting that in the hands of the contractor and the engineer to kind of wrap that up as efficiently and cost effectively as possible. I do think certain types of things lend themselves, we do deploy the job order contracting mechanism for really small work, because it's kind of a pool of little jobs that, the little ones can actually be just as painful. And so that is a fast way to get certain builders that might already know your facilities and they're doing small scale work. It allows them to go quickly into construction with sometimes a very limited set of drawings or scope because of the nature of the small projects. So I don't think there's one answer. I think there's a lot of answers. And one of the key things to do at the front end, the really early end, which I feel like always gets shortchanged in general, is think through, how do I want to deliver this? If I'm an owner, do I have in-house capacity to manage it? Do I need, a management? Do I need to hire managers to help me through the whole life cycle, through the design phase, et cetera? And then what delivery model matches is kind of the most ideal scenario. At health and hospitals, we don't always have the liberty to do design build. We don't have any legal framework for integrated project delivery. The emergency really allowed us to kind of just run on not to exceeds in time and material so that we could really just focus on the task at hand. I think, not to exceed time and material, not always ideal, but if you have the right management around it and you have a very limited set of requirements and goals, I think it can work in the right model with the right oversight. It does require additional oversight. It requires, making sure you're checking all the times and people are signing off on that and it's on the up and up. So those are some of the downsides of time and material. We had an army of construction management professionals checking the 24/7 nature of that job. It was 7 days a week, 2 shifts a day. So, there was a lot of time and material sheets and prevailing wage sheets, because we're New York City and that's how we do it. That had to be like level setted with our accountants to make sure it was compliant.
Really complex, but thank you for that detailed answer. Yeah. So let's see. Julio and Joseph are asking some questions about our current market around inflation and the global economic conditions. How has that affected your current work, or as you move forward?
Yeah, I think, I'm definitely not an economist or a crystal ball, so I want to couch my words, but it's definitely impacting us. I think that it's a hard time to be a contractor, very much so. I think that inflation is definitely here, and supply chain challenges continue to challenge all of us. So I think that we kind of have to tackle those things as they're approached. And, I think the market and the industry will probably kind of have some reaction from a contractual perspective and how they think through certain contract terms. I think that we're going to be challenged a bit by the construction industry about contract terms in certain areas of externalities that are outside the control of the whole community. And so I do think, unfortunately, things are going to cost more, and unfortunately that will mean some projects will have to be shelved, which is not an ideal situation. I think the most we can do is try to plan for it as much as possible and try to stay close to our awareness of what the market is doing and try to be fair to the contracting community for certain bodies of work. There was a moment in time where, because the market was so dry, we were actually getting numbers below our engineer's estimate, like 20% below, because so many people were trying to get into our market. That has gone away. And we're seeing some of it being about even. I think that the estimating community is kind of staying definitely really close to this. And I think, the only good side I could see with this, with the amount of press and media about inflation and supply chain woes, it does allow some understanding when we have these incredible parts that don't show up and impact our projects, because that is bound to happen, unfortunately.
Gotcha. Your answer points me to Patel's question here. What are qualifications that contractors need to get into the hospital healthcare industry? So
it depends on the type of work. But if you're working inside the hospital on renovation, usually we have requirements of having healthcare experience. We also have substantial ICRA standards and certain degrees of training that's required. There's, safety plans that have to be in place, air quality control plans that have to be in place. There's incredible infection prevention and air quality procedures that are required for all hospitals undergoing construction in specific areas. There also has to be posted ICRA plans and usually negative air pressure and multiple dust mitigation measures in place, well beyond a typical, I'm doing a renovation in a non-hospital space. I'll just say it that way. So there are those kinds of requirements. And then, we do have kind of standard contracting requirements that associate with New York City, which that list I could go on. And I don't know if you're asking me that type of question, but there's lots of other New York City related requirements.
Yeah, I'd be curious. Arby is asking a question: who are the governing bodies in terms of oversight? Maybe just hit one.
Sure. So Health and Hospitals is a corporation. We have a president and a board. And so we get the beauty of a corporation, which should be a little more streamlined, but our capital dollars come from the Office of Management and Budget. as part of the city's debt service largely, although we have state grants and we have, sometimes we're fortunate enough for philanthropic dollars. And we also have some bond work that we ourselves have bonded. And so our entities of oversight, besides our own organization, and I chair our capital committee, report up to the board for resolutions for construction over $5 million in service contracts. Aside from our board, we also register our capital jobs if they're capitally funded to the city controller, who's separately elected in the city of New York. So definitely plenty of acronyms and plenty of oversights. And then all of our capital work has to go through a typical municipal bond capital eligibility process, which is not unique to New York City. I think there's bond councils throughout the nation that make it challenging for municipalities to confirm capital eligibility of that capital improvement work.
Great. Great. Well, I'm going to shift gears a little bit. We have about 10 minutes left or a little less. And there's a number of questions just around career paths and different opportunities.
Sure.
One's from Tom, and I know have spent time with Construction Management Association of America, really addressing topics around this area, but he's curious, he hears terms like project manager and program manager, and is there really a difference, and could you discuss?
Yes, I teach this, or I used to teach this when I was spent more time being an instructor. So, project management, fundamentally managing a project that could range from only the construction phase, but ideally from beginning of inception of a project to design management as a procurement process, management of the construction contract and the design contract, and bringing a project to full fruition. Whereas program management is kind of like taking it to the next level, where you're responsible for multiple projects concurrently as part of a program. Program management also is often a service that is deployed on large scale jobs, where really, if you think about those large jobs, there's many little projects within them. And an example of that would be, we're transforming LaGuardia Airport. Well, there's really a whole program of make-ready work and building a garage and building a substation and all these other things. And so it's really a program, a holistic program. And so we refer, when we talk at health and hospitals about our capital work, we call that a program. Within that program, there might be an energy program, there might be a state of good repair program, but they're a program because there's multiple projects, because it's not a one standalone project. I started my career doing many projects at a campus in New Jersey as an owner's rep. And so at that point, I was doing projects. Then I had more projects, and I was doing a couple projects at once. So I kind of was doing a program, but really I was learning project management. And so I think that's the differentiation, the skill set and capabilities. It's kind of an evolution, I think, for an individual as they work in their career. I think if you get the opportunity to manage multiple projects at once, that's a testament to your capabilities to keep the multiple balls in the air and be engaged on multiple projects.
Great, thank you. That comprehensive answer there. There is a difference there for sure. Yeah, so Rakan is asking about entry-level positions, and three in particular: being an estimator, being an entry-level project engineer, or a project manager. Could you describe, in your experience, what?
Sure. I think, yeah, I think those are all very important experiences to be a part of. And frankly, what all of you should look for are companies that allow you to rotate through different experiences. I had the chance of estimating in my career path. I started in the title of systems analyst, which really was a title that allowed me to be kind of everywhere doing all sorts of different things for the company I first worked for. But what excited me about the company I first worked for is they had a rotation program, so I could actually get a better sense of the different things. Entry-level project management, sometimes called project engineering. Companies really use different titles to describe similar types of tasks and work. So I would encourage you to ask as you're interviewing, can you describe the different tasks and work? And there's also the entry-level inspector title that also is looked at. And in all cases, the key for all of you is to get boots on the ground experience in the different areas, for you to understand how estimates come together and how they're developed by, senior estimating professionals, and to kind of learn that process is very valuable for you in your career. To be in the field and to see how the physical work is happening, and to be able to ask a lot of questions of the superintendents and the senior resident engineers. That's also very valuable experience. And to get a sense from even the trades themselves, what it takes for them to do the work, that is also what very much informs estimates, because estimates are built up by the productivity of the workforce. So I don't think there's one perfect answer. And I think you also need to know who you are and what you would enjoy, and how that company sees that role evolving as a career ladder. There's a lot of great options, and you should kind of follow your journey and ask the questions about what that experience would be like. And the more internships you can do, the better.
Yeah, all great advice. A lot of it's just what opportunities come in front of you as well, right?
Absolutely. Yeah.
Siva's asking about project management, and specifically how do project managers deal with risk or mitigate risks?
So that's a very snazzy word, risk. It's there no matter what. And you can't, there's certain things you can't change the fact that that risk will be there, but you can plan for it. And so, risks come in many forms. They come in the form of inflation, supply chain, unforeseen conditions. And so I think as you plan out a project and you discuss with the stakeholders what that project is, ideally you can budget for some risk pool. That's why you have project contingencies of different types. Ideally, you can budget for it. Ideally, you're maybe taking it into account in a schedule. As you plan out the schedule for the job, you might say, we think it'll take this long in a good day, but in this case, especially in infrastructure, you might have weather considerations. So you might plan for a certain amount of cushion in your schedule. So you also, depending on your delivery model, you could even have like shared savings of some of the risks. So if you think your guaranteed maximum price in that type of delivery model, you might have, allowances that are there that tie to those risks, that if they use the money, it goes toward the job, you approve that. But if they don't use the money, you split the savings. So there's like a shared incentive to not use the risk unnecessarily, and there's not a big profit gain there. So I think there's lots of different opportunities and tools to kind of try to plan the best you can for risk, but there's not one silver bullet.
Great. Well, we're starting to run a little short on time, but let me see if we can maybe two more quick questions here.
Sure.
One, Evan is asking, it's a general question. He says, if anything, what has prepared you for working on such large scale projects?
Life. I don't know. I don't know. I just feel like we all have our own journey. And I think, listening and being, I advise all of you to be willing to learn and ask questions as much as you can, and don't be shy. We have a very fast-paced work environment in design and construction, and the people that are engaged, the people that talk to their supervisors, the people that demonstrate willingness to not just go the extra mile, because it's not that, it's like to really get the job done. That's how you get recognized and you're able to grow. Yeah,
I know we want to be done learning when you graduate, right? But you're continuously doing that throughout your
It's
career.
just a different learning. It's actually more fun. You never, like, I feel like I'm always learning something new. It's like, I didn't know that, which is great and makes life really enjoyable.
Last question from Pranjal here. It is specifically for education. So what made you decide to go for your MBA after your civil engineer?
Sure. I had a really great mentor, one of my first jobs, and I loved getting my engineering degree. I would never change that. It was a great experience, and it helped me problem solve. Like, really, I felt wired to problem solve. And, you know, as I was getting mentored by one of my first boss, he would say, you've got all this down, you just have to get your MBA now. Like, because there's no time in engineering school, unless you do like a 5 or 6 year program, to understand the business side of, you know, a company, you know, everything that goes with the qualities you need to manage staff, manage organizations. And I really felt like the MBA was a good additional journey for me and a challenge, because I did it while I worked, which also I think made me more of a rigorous individual that could take, I learned to kind of work and go to school, which in that way also allowed that MBA to be much more real world as far as applicability to my work. And it helped me gain that ability to just get more done in a limited amount of time. And so I feel like that was a great combination for me, because it helped me see design and construction in our industry from a business perspective as well. So I think that was a great combination for me personally.
Excellent. Yeah, thank you for sharing that and sharing the thoughts from your mentor as well. So yeah, that's just kind of wrapping us up. Christine, you know, congratulations on being an NAC member. It's quite an
Thank you. Yeah, no, it's quite an honor to be a part of the National Academy of Construction.
Yeah, so I'll just ask from that, kind of reflecting back on your career, and I know it's still ongoing at a full pace as well. But do you have any final advice for our, you know, our participants here as they get ready to enter the design, engineering, and construction industry?
I think, you know, really aggressively work in the area that you're passionate about. Find your passion, and it's going to be a journey for you. And find your mentors. It's super important to find great working mentors and have an open mind. You've worked hard for these degrees, but that's like the beginning of the journey of learning. If you keep your eyes open and your ears open, you're really going to be able to learn from everybody around you. And that's what I love about our industry, from you know, the carpentry foreman in the field to the executive in the C-suite. They all have nuggets of wisdom that you can learn from if you keep your ears open and you ask questions, and never be afraid to ask questions, because that is surprisingly more welcome than you think. So that would be my advice.
Well, thank you for those words. You've had an incredible career, and I know made such an impact in the, you know, just design, construction, and healthcare industry. Just thank you for sharing all that. We really do appreciate it, and your passion that you're advising folks to follow here certainly shows through on your end.
Thank you so much, Keith. It's wonderful to be here. Thank you so much for participating.
Yeah. Well, I have a few thank yous as well, and then we'll announce the winner here. But thank you to the National Academy of Construction members. It's their donations and their time giving back that makes this AMA a possibility. So thank you all. Thank you, Sandy, for all you do to make this so smooth, and Wayne Crew, and all of the folks back at NAC that allow us to do this. So thank you all, our participants, for so many great questions. We could only pick one winner, and so our random winner from the questions here today is Chris Hernandez from Texas Tech. So Chris, we will be in contact with you via email to get you that scholarship. And this is our last AMA for spring. So look for those next advertisements for fall, and have a wonderful summer. Christine, thank you again.
Thank you so much. Take care.
Bye.